So it's important to start out by defining what diabetes is. So diabetes is when your body either doesn't make enough insulin, which is type 1 diabetes, or your body can't use the insulin as well as it should, which is type 2 diabetes, which we'll be focusing on for most of this presentation. Some basic facts and statistics about diabetes related to populations in the United States. First of all, there's 34.2 million individuals who have diabetes, both diagnosed and undiagnosed, which makes up about 10.5% of the United States population. 7.3 million adults with diabetes are unaware that they have it. So their lab values show that they have diabetes, but they're unaware of this diagnosis yet. Of the 34.2 million individuals with diabetes, about 90 to 95% have type 2 diabetes, making it much more prevalent than type 1. It's also important to note that the percentage of those with diabetes increases with age, so as you get older, the incidence of diabetes increases as well. Between the United States individuals that have diabetes, 17.9 million of them are men and 16.2 million of them are women. This shows that more men have diabetes than women. Looking at race and ethnicity of those with diagnosed diabetes over the age of 18, 7.5% are white, 9.2% are Asian American, 12.5% are Hispanic, 11.7% are Black, and 14.7% are American Indians or Alaskan Natives. This essentially means that white individuals have a lower incidence of diabetes when compared to Asian Americans, Hispanics, Blacks, and then American Indians and Alaskan Natives who have the highest incidence. Other populations and risk factors for type 2 diabetes include family history, the individual being overweight, eating an unhealthy diet, and physical inactivity. So these would just be important to look at for individuals with diabetes and certain populations that would be affected.
So the scope of the problem. Diabetes is a global pandemic. Over 422 million individuals suffer from diabetes worldwide, and that adds up to be about 1 in 11 people. It's expensive. The United States spends around $245 billion in relation to diabetes. This can be indirect or direct costs such as insulin or hospital stays. Some epidemiological data. The highest prevalence of type 1 diabetes is in Finland and type 2 is in the United States. Both type 1 and type 2 can occur at any age, and both are most often diagnosed in men. Type 2 diabetes accounts for the majority of the diagnoses. Over 85% is type 2. So for the rest of this presentation, we will be focusing on type 2 diabetes in our primary, secondary, and tertiary interventions.
The primary level of care aims at preventing disease before it ever occurs. This is first done through risk assessment. Risk assessment tools such as questionnaires and self-assessments have been found to be beneficial in the prediction of type 2 diabetes development, as they can be used to gather information regarding one's age, sex, BMI, ethnicity, physical activity, diet, and several other factors that influence one's chance of developing type 2 diabetes. Then healthcare providers can determine whether one would benefit from annual health screenings. These health screenings would include regular risk assessments along with A1C level and blood sugar tests. With the identification of risk factors, healthcare providers can also determine whether one may benefit from a lifestyle modification program, which would be targeted towards modifiable risk factors related to type 2 diabetes, with a focus on weight, physical activity, diet, smoking, and alcohol consumption, as these have all been found to influence one's relative risk of developing type 2 diabetes. This is the second step in the primary level of care of type 2 diabetes. According to Wu et al., body weight is the most crucial risk factor for type 2 diabetes, as excess body weight can increase insulin resistance and glucose intolerance. Physical activity and diet go hand in hand with body weight, and there are therefore also important modifiable risk factors. According to Wu et al., physical activity may contribute to a 30 to 50% reduction in one's risk of developing type 2 diabetes, as it helps improve glucose tolerance through weight loss. Diet also achieves weight loss and thus reduces insulin resistance. Food recommendations should be individualized for each patient as everyone has different dietary preferences due to a variety of factors. However, a general rule of thumb is that a high intake of veggies, fruits, and fats from veggies supplemented by nuts, legumes, dairy, and fish for protein, along with unrefined grains, is preferred. The consumption of red meat and highly processed foods should also be limited. Lastly, we will target smoking and alcohol consumption in our lifestyle modifications program. A study conducted by Shi et al. Showed that smoking was associated with an increased incidence of type 2 diabetes, while moderate alcohol intake was shown to be associated with a decreased incidence of type 2 diabetes. Thus, these are both important modifiable risk factors that should be included when appropriate when forming a lifestyle modifications plan for a patient.
The secondary level of prevention involves reducing the impact of a condition that has already occurred. This is done through early diagnosis and treatment of the condition as soon as it is caught. This will ultimately help slow the disease progression and reduce the likelihood of complications occurring. The first step in the secondary level plan is early detection of the problem. Detection of type 2 diabetes is completed through 3 diagnostic tests. Diagnosis of this condition is indicated through a glycated hemoglobin test, or HbA1c, of 6.5% or higher on 2 separate tests, a random blood sugar test of over 200 milligrams per deciliter, and a fasting blood sugar test of over 126 milligrams per deciliter on 2 separate occasions. Oftentimes, type 2 diabetics present with symptoms. The most common symptoms include polyuria, polydipsia, and polyphagia. If an individual presents with these symptoms, they should be screened for type 2 diabetes. Other individuals may remain asymptomatic in the early stages of the condition. If this is the case and they possess risk factors for type 2 diabetes, they should also be tested. Again, these risk factors include obesity, family history, race and ethnicity, a sedentary lifestyle, hyperlipidemia, and prediabetes. Once diagnosed, the next step in the secondary level of the plan is prompt treatment. It is important to educate patients that lifestyle modifications should be made. These modifications include a healthy diet, exercise, daily monitoring of blood sugar, monitoring cholesterol intake and blood pressure, and reducing alcohol intake and smoking cessation. It is also important to adhere to a medication regimen. Some common medications type 2 diabetics take regularly include insulin, metformin, sulfonylureas, glinides, thiazolidines, DPP-4 inhibitors, and many others. By making lifestyle modifications and adhering to a medication regimen, this will help prevent complications of type 2 diabetes and lessen the risk of progression of the disease.
At tertiary level of care, this is when each patient should have their own individualized care plan that's tailored to their lifestyle, as this type of setup has proven to be most successful to keep them at the healthiest state possible, given the progression of diabetes. As discussed in secondary intervention, frequent blood glucose monitoring is imperative because a stable blood glucose level helps to prevent organ damage and neuropathy. Should neuropathy progress, this is when foot care becomes very important. Patients need to inspect their feet daily, avoid hot baths and soaks, wear cotton socks, and protective shoes. Lifestyle changes mentioned in primary and secondary levels must also be continued. Moderate alcohol intake is actually encouraged because a moderate amount of alcohol, which is 1 drink per day for women, 2 drinks per day for men, can help prevent the progression of cardiac diseases in patients with type 2 diabetes. When we have patients that are hospitalized who are type 2 diabetics, research is showing that we should actually move away from the sliding scale insulin dosing. This is where we decide how much insulin they should get based on their preprandial or postprandial blood glucose levels. Instead, they're recommending that we dose out insulin based on the number of carbohydrates they will be ingesting in their meal. This could be something that we see changed in hospital care in the future, so be sure to keep your eye on this. Additionally, drug therapy can be started at this level, which would include oral antidiabetics. Most commonly, we use metformin, and this may be used with or without injections of insulin. So now that we have all this information, what can we do to take action to help prevent more cases of type 2 diabetes or the progression of the disease? Well, the American Diabetes Association, in conjunction with the CDC, have a program called the National Diabetes Prevention Program. This offers levels of support no matter where you are on the scale of potentially becoming diabetic. So maybe you only have genetic factors, maybe it's just in your family, or maybe you've just been dosed as pre-diabetic. Anywhere along the timeline of diabetes, they can offer support and intervention. If we were to take action today using the information that we've gathered, some things that we thought would be helpful are encouraging more nutrition and exercise campaigns in schools and places of work. So this could even just be a poster in a cafeteria that says, we recommend drinking water, tea, or coffee over sodas and juices. It could also be use that 30 minutes a day instead of scrolling on Instagram to take a nice long walk. At primary level, this is where we can say to take advantage of employee or insurance program incentives to get your annual physical exam. This will help start the conversation about any risk factors someone may have toward becoming diabetic. At the secondary level, this is where we could connect a patient with support groups, such as the National Diabetes Prevention Program, so that people can stay in touch with others to help encourage them to stay at a healthy lifestyle. At the tertiary level, where they have the disease and there's no turning back, this is where we want to make sure we are encouraging primary care physicians or nurses in hospitals to create individualized care plans that are tailored to patients' lifestyles. If we put all these together, hopefully we can help prevent the further progression of type 2 diabetes in the U.S.